My talk is about tendon problems, tendinopathies. This occurs commonly in people who are active, such as people who jump, people who run, people who swim or play tennis, and they get painful overuse conditions. There have been many advances in biology and in drugs and ways to try to treat these conditions. But despite those advances, the best proven treatment remains targeted exercise, loading the tissue in a range that will stimulate repair and allow the patient effective return to play. Physios sometimes feel under pressure that if things aren't going well, people aren't dramatically recovered in an unrealistic time frame. Should we go to the PRP or the cortisone?
You would have heard a lot through the literature about the PRP, so it's great just to get his clinical perspective on it and just to see what he thought, and obviously he's held in quite high esteem, so it's great to get his perspective on it, and hopefully I'll take that into my management of tendinopathy as a physio as well.
It was good to see a balanced view on PRP and showing the extent of the research out there and showing what the limitations of the research are.
Well, my talk tonight is about groin pain, which is a major problem, particularly in footballers, probably because of the change of direction involved in football. And it's one of the major reasons why footballers miss lengthy periods of time with injury. So we're going to look at the different causes of groin pain, why footballers in particular get groin pain, and we're going to look at ways in which we might be able to firstly prevent them developing these problems, but also once they do have the problem, how we might manage it, particularly with physical therapy, with exercise therapy, and in most cases we can avoid surgery. I'm going to talk tonight about groin pain, specifically groin pain in footballers. It's one of the most common problems that those of us look after, one of the most common causes of lengthy periods out of the game. Very confusing, controversial area.
Peter's is very good because he brought up the kind of the multifaceted problem with pelvic or groin pain, and instead of just treating a scan or an x-ray, instead of going around and treating the whole pelvis. That's what we found the best part of that treatment. Look at pubic overload, adductor problems, the glute strengths, the increased tone, decreased tone, what's working, what's not working, and bring it all into a multifaceted, multifactorial aspect of treatment instead of just going and getting surgery and fixing the symptoms and not fixing the problem.
Well, I'm a physiotherapist, so I'm working with a sports team as well, so we'll see a lot of that kind of pubic overload and groin related, and just the different perspective he takes on it, and just the different contributing factors are really beneficial just to even consider in my own clinical practice.
There's more and more evidence now that exercise or lack of exercise is a major problem in our society, and I think if we can help facilitate an increase in the amount of exercise and the type of exercise that's done, then we can play a major role in society in the next 20 years or so. I think from an injury point of view, I think prevention is the buzzword. We're beginning to understand more and more why people get injuries, and then and hopefully we can start having more success anyway in preventing particularly the sort of serious injuries like cruciate ligament injuries and groin injuries and so on.
The future of sport and exercise medicine is very exciting because people are starting to recognise the power of exercise as a health modality, so in preventing chronic diseases, but also in treating chronic diseases. And as we're more able to study exercise now, we're actually realising how powerful the benefits were. And the limitations before were that we couldn't see how exercise affected the brain and improved mood. We couldn't see how exercise affected the brain and improved brain function. And now we've got MRI and sophisticated methods to show the benefits of exercise. Now this is starting to be recognised, the benefits of physical activity are starting to be recognised. So I think it's a very exciting time for people who can prescribe and for members of the public who appreciate that exercise is the most powerful therapy.